Hello, hello, and welcome back, party people. Let me hear some noise. No, not really. Don't, because I can't hear you. So, guys, we have a very special guest today, and I'm going to kick this over to my MC co-host, Amy, to introduce our very special guest. So, Amy, who are we talking to today? Who's this foxy lady?
Yes, I'm super excited to have Sarah on the podcast. We actually met like 4-ish years ago, which it's kind of crazy. But Sarah Hornsby, she's a dental hygienist, an orofacial myofunctional therapist, speaker, and entrepreneur. She's the founder and creator of MyoMentor, a comprehensive training and online educational platform for myofunctional therapy with over 600 graduates. She opened Faceology, her myofunctional therapy practice, in 2010, and today it is a thriving telehealth specialty clinic with a focus on adult patient populations and complex treatment cases. Sarah is also co-director of the Myofunctional Therapy Department at the Breathe Institute, which she is actively involved in publishing research on myofunctional therapy in an effort to grow the field. Woo! We're so happy to have a myofunctional expert here. I know we did a little talk, like a little series together 4 years ago, and I thought it was really fascinating. And there were so many connections between gut health and the myofunctional space. But I think just to start, like, tell us a little bit about yourself and your profession. I think that would be really helpful for the audience.
Yeah, no, thank you. That was a great introduction, and I appreciate it, Amy. It's so fun to be back here and to see you and to talk with you because, yeah, I think it was about 4 years ago that we last connected and we did our little YouTube interview or whatever we called it back then, but it was fun. Yeah, the interesting thing about my field is most people have never heard of it. So I'm always, in the position where people are like, so what do you do? And I have to say, well, how do I explain this? So I am a hygienist. That's my background. Although I haven't practiced clinical dental hygiene, I haven't cleaned anyone's teeth in over 10 years. So you definitely wouldn't want to see me as a hygienist right now. I would fail. But I kind of got into this interesting field because I thought, well, I don't think I can be a hygienist forever. I was really new. I had only been practicing for about a year and I was looking for other options. So I kind of stumbled across this random field that said, as a dental hygienist, you can change your career. So I kind of took a chance, took this class, paid like $2,000 to get this training. And I was so skeptical. I thought, oh my gosh, this can't be a real thing, or else I would have heard about it. But as I learned more, and over the years, we've gotten so much more research around it that basically, to just summarize it, it's basically I'm like a physical therapist for your mouth. So I teach people tongue exercises, lip exercises, face exercises, and the main thing that this helps with, which is why my field is becoming recognized, is the big deal is sleep apnea. That's where most of the research is right now. So we're looking at how does our breathing affect our sleep? And as you guys know, our sleep affects every other system of our body. If you're not sleeping well, you are not going to be functioning well on so many levels. So it's really the sleep apnea that's gotten attention, but the applications of this field that I'm a part of for dentistry and digestive health, like what you guys are talking about, it's really pretty limitless. And I think the thing that I like about this field is it's actually addressing a root cause of so many things. So I basically help people breathe through their nose, get their tongue in the roof of their mouth, and swallow correctly. And it's that simple, but there's so many people who don't do that it's actually pretty astounding how under-recognized and under-diagnosed these symptoms are. So anyway, that's a good start. So hopefully that lays the foundation for everyone listening.
And I like the way you described it. Like, you're like a physical therapist, but for your face. And
exactly.
I think that's a really
totally
good way to put it. And
yeah, it makes it simple. I mean, my big thing that I try to do is how do I take complex topics and simplify them for not only my patients, but for the healthcare providers that I teach and train and work with. So my practice started off as something where I was just treating patients, and then it grew and evolved over the years. And now I actually speak internationally and I teach courses to dentists and doctors, hygienists, speech pathologists, nurses, all sorts of medical and dental professionals who are like, what is this field? I think it can help my patients. I want to get training in it. I want to refer for it. And so my practice and career has evolved a ton over the past, I guess, 11 years now. So,
and I'm curious, like, if a patient were to come see you or somebody like you, for example, what sort of symptoms might motivate people to work with somebody in your field? So you mentioned sleep apnea, right? So
yeah, sleep
that would be
apnea.
one.
But that a lot of times people don't know they have sleep apnea or any form of sleep disordered breathing. So it might be snoring that gets them kind of down the rabbit hole of like researching. A lot of people, it's mouth breathing, which sounds funny, but that's the most Google searches, the most hits that I get on my website is why am I mouth breathing at night? Why is my kid mouth breathing? And as you start to understand, like it sounds so simple, like who cares if you breathe through your mouth or your nose, but once you get into the science and how it affects our physiology and our body and our sympathetic versus parasympathetic nervous system, you can start to realize how big of a deal it is when you breathe through your mouth and not your nose. And so a lot of people find me that way. Tongue tie is a whole other big topic that we can get into. It affects digestion a ton. And that's another thing. I think as tongue tie gets more recognized,
Yeah.
we're really getting a lot more research around that, only really since 2017. And so as we actually have it more in the literature, now people are starting to learn about it, ask about it. There's, Facebook groups about it. And so a lot
Oh,
of
yeah.
people reach out to me because of tongue tie as well.
And would that be like for somebody who didn't have a tongue tie revision or somebody who had the revision and then still is experiencing issues,
It
after
could
the
be
fact?
both. Yeah, it could be
Okay.
both. So it's crazy because tongue ties they vary and range in severity. So I mean, there's really obvious ones where like
Yeah.
the tip of your tongue is literally anchored to the floor of your mouth. You can't lift your tongue. It's like a really bad version, but that's really
Yeah.
only maybe 5-10% of the people that I would see would be in that really bad
Yeah.
category. The majority of people, and I'll have to send you guys the references for this, but we have a new classification system that basically puts people into 4 categories: grade 1, grade 2,
Okay.
grade 3, grade 4. If you're a grade 3 or 4, you're obvious. This is like, you can't move your tongue more than 50%, just to make it simple. The grade 2s are the in-between people. And these are people who look like they have really good tongue mobility, they have pretty good range of motion, but functionally, it's not there. So they have challenges. They have these myofunctional and swallowing issues and tongue posture issues, but you can't really tell unless you're in the know in a lot of these like newer grading scales and not just measuring the frenum, but looking at tongue function. And so that's what I teach in my courses. That's what I talk about all the time. And most dentists and ENTs and speech pathologists don't even know about these things because it's literally so new in the literature that it's not in textbooks. And
Yeah.
so again, these grading scales, the first one was only published in 2017. So unless this is like an area you've spent a lot of time researching and reading about,
Yeah.
you wouldn't even really know. So unfortunately, you can't just go to your doctor or dentist and say, do I have a tongue tie? Because unless you're really obvious, they're probably going to say no.
Yeah. And that, maybe first topic we could talk about is tongue tie, perhaps, since we're starting on that anyway. So I was
Sure.
tongue tied as a baby.
Ooh.
And then they
Really?
didn't find out. Yeah. And then they didn't find out until I was about 2. And I was
hmm
having an ear surgery. And my mom, that I wasn't speaking a lot yet at about 2.
hmm
And my grandfather, who also was tongue tied apparently as a baby, told my mom
Wow.
and said, you need to have her checked for a tongue tie. And basically, when they put me under anesthesia to put tubes in my ears, my mom asked the ENT, hey, can you check and see if she's tongue tied? And they were like, no, lady. No, this was 1986, right? Or no, 88.
Yeah.
So no way. And when they brought me back out of surgery, they were like, oh, yeah, you were right. She was tongue tied. So we clipped it while she was under anesthesia. But it makes me think I must have had a pretty significant one if they recognized it back in like
Yes.
1988 and it was affecting
Probably. Yeah.
speech. But then likewise, my
Definitely.
6-year-old daughter was tongue tied as a baby. And
Interesting. Okay.
we saw, I'm trying to think, we saw, I think, 2 different IBCLCs, lactation consultants,
hmm
and her pediatrician and a midwife at the birth center all looked at her and said she did not have a tongue tie. And it wasn't until we went to like a super tongue tie literate IBCLC who specializes in that she took a look and was like, yep, yeah, she's tongue tied. It wasn't an
And that's,
anterior tie, like it wasn't a grade 3 or 4, what
yes,
you're describing, but it was still
yes.
there. So we did have it revised when she was about 9 months old. So
Yeah, and that's the big challenge. And this is where, so, the babies are getting a lot of attention. And so now what happens is we learn, oh, this runs in families. So I
yeah.
end up where a lot of my practice is adult focused. So I don't really work with kids or
Mm,
babies at all. But what happens is like a mom is struggling with breastfeeding, and
yep.
that's, one of the big challenges with a tongue-tied infant. And so they're not latching, they're not gaining weight, they're having all these issues. And this poor mom is going around
Yeah.
talking to all these doctors saying, I think there's something wrong. Like, and they're like, no, you're fine. You just need to like try harder. And so a lot
Oh
of
my God.
moms kind of go through this really challenging phase of feeling like they're crazy. And then finally someone, who, like you said, is in the know, they're like really immersed in the tongue tie world, says, yeah, it's a posterior tongue tie, or like what
Yeah.
I called it, a grade 2 tongue tie. And they're
Yeah.
not obvious. But I end up then the moms start looking at themselves and they're like, I have a tongue tie. Or they look at their
Yeah.
husband, like,
Uh,
he's got a tongue tie. And then they start realizing, oh, tongue ties and snoring are connected. And so
yeah.
these are perfect examples of how people might find my field or me.
Gotcha. Yeah. It's so interesting because again, like I think even if you get the tongue tie recognized and revised or snipped or like, lasered, I think probably in like I'm going to imagine the equivalent of the conventional medical world in your world is going to be like, okay,
Mhm.
snip, snip, you're done. See ya.
Exactly.
Like
Yeah,
you're
you
good
hit the
now.
nail on the head. Yeah, so my job is, and what I end up teaching so much about and like blows people's minds, which to me it's common sense, but these doctors are like, oh my gosh, you have to do exercises before and after the tongue tie surgery. And yeah, in dentistry, we're very procedure oriented. So it's you come in, you have a procedure, cut the tongue, and you're done.
Yeah.
But the whole point of my field is to restore normal function of the
Yes.
tongue. So if our goal is to get the tongue to the palate and the lips together and nasal breathing, releasing the frenum, like cutting the tongue tie, is just one step in that process.
Yeah.
So it's not like the end game isn't just, oh, cut the frenum. It's, well, how do we get the function and all of these other bigger picture things moving? So it can actually be detrimental if they just cut the frenum without pre and post op exercises and
Mm,
rehabilitation. I mean, that's the whole point of what I do. It'd be like going getting back surgery without physical therapy, or shoulder
yeah.
surgery without physical therapy. I mean, so
Yeah.
it doesn't really make sense. And there's so much involved in this discussion that, it's actually pretty amazing that in the dental field, speech field, all the people that are focused on the mouth, that we're not actually looking at the function.
Yeah.
It's amazing to me. So I guess that's just, modern medicine in general, but
Yeah,
Yeah.
I think so. And I'm curious, like, I guess to try to connect it to gut health and not go down to, the tongue tie tangent just because I'm interested in it. Um, Although we could just make this whole episode about me. But I wonder, like, do you see a relevance with like the vagus nerve? Because the vagus nerve is innervating some stuff in
Yeah,
your nose throat area. So is there a tie-in with like the
definitely.
vagus nerve or nervous system function? And then,
For
or are
sure.
there other mechanisms
Actually,
that it could affect the gut?
oh, definitely. I mean, I can break it down. So whether you have a tongue tie or maybe you just have like poor tongue tone, maybe you just have really bad coordination of your tongue. I mean, in dentistry, we're used to this. We, look in people's mouths and we're just like, whoa, this person has like no control over their orofacial muscles. And so if you're a non-dental person, it's maybe weird to think about, but you could try it if you're at home and you want to look in the mirror. Can you move your tongue left and right without moving your jaw with it? Can you stick out your tongue?
Okay, Amy,
Um,
for
you,
those on YouTube, let's demo.
you want to? Yeah, there you go. So she's moving her tongue left and right, and her jaw's not going. Well, somebody with low tongue tone might move their tongue to the left, and their jaw's going to go with it. So I can probably demonstrate a little bit. It looks like
Yeah.
Okay.
so
Well, I
they
guess it's
don't have good coordination, right? They don't have, I mean, it's really all I'm doing is just like a physical therapist. It's neuromuscular re-education. So it's your brain connecting with all of these muscle or nerves of the muscles of the tongue and the face. So whether
well, and
it's
I
a tongue tie
guess
issue, tongue tone issue, it's going to affect our digestion. And I can totally break that down, you know, on so many levels. So it doesn't actually matter like the physical difference. It's all going to lead to low tongue posture, which leads to mouth breathing. And so that's the big like problem is really mouth breathing, poor coordination, and then that affects everything. So if you don't have the ability to control food in your mouth, you're not going to chew very well. So if you can't breathe through your nose, I mean, we all know the feeling when you're sick and your nose is super plugged up and congested, and now you're trying to eat and it's miserable. So
Yeah.
if you're a kid with a blocked up nose or an adult with a severely deviated septum or sinus issues, and eating is such a challenge, you're going to eat fast. You're not going to chew thoroughly. You're probably going to, you know, gulp down tons of air while you're eating. You're going to choose foods that are more soft, pro-inflammatory, processed, you know, easier to eat.
Sorry to
I
interrupt,
see
but
your,
you just okay. You might not be surprised at this, but this is like a really random factoid about me. When I was 2, or maybe like 1.5 or something, when I was really young, when I was like 2, my mom wrote down in my baby book that I complained that meat was too hard to chew.
Exactly.
And she noted that throughout my childhood, I much preferred things like yogurt and pudding, where I could just gap them down and there was no chewing required. But I thought all this time, I was like, wow, that is laziness to a whole new level. I mean, like, I like crouching in my jammies and watching Netflix, don't get me wrong, but that's like next level laziness. But now I'm looking back and I'm like, oh, okay, you're connecting dots for me. So thank you for this.
Definitely.
Okay.
So a lot of I mean, all of these symptoms start in childhood. So no one just wakes up one day as like a 40-year-old and has these issues. Like these things start at birth. Typically, they start with a tongue tie or they start with allergies or some sort of inflammation in the early days that lead to mouth breathing. And so, you know, when I work with adults who have obstructive sleep apnea, it's almost like we have to start unraveling and going back in time to like, when did these things start and what caused it? And yeah, if you can't breathe well, you're not going to chew well, you're not going to have good digestion, you're not going to sleep well. Just the mouth breathing component alone, I mean, when you're mouth breathing, your body is in more of a state of like sympathetic, like fight flight mode. So when you mouth breathe, you're breathing with your chest, your upper part of your lungs. When you're nasal breathing, your body switches to breathing deeper into the lungs, activating the diaphragm, and you shift more into the parasympathetic state. So just the breathing, like mode of breathing will affect your digestion because of that sympathetic versus parasympathetic tone. So, like I said, there's so many levels where what I do impacts other areas of the body.
Yeah.
Again, like if you're not sleeping well too, if you're not getting into deep sleep, like stage 3, stage 4 deep sleep, you're not getting into REM sleep. Well, the deep sleep is when our bodies repair, regenerates, when our immune system like recovers, and it's when all the processes that you know we go through at night to like restore and regenerate our body. If we're not getting in deep sleep for very long, we're going to have way more inflammation in our body. We're going to be, you know, moving into like chronic fatigue. Our hormones are going to be affected. We're going to have higher levels of inflammation. Our digestion will be affected because we're not getting that like parasympathetic time that we need, that rest digest while we sleep, that happens in stage 3 and stage 4 sleep. So it's really crazy. So I don't know
Yeah.
what you want to go on from there, but it's like so much, right?
Yeah, well, one thing too, because I know we talked about it in our like little YouTube session, was
Yeah.
how like tongue position is like vagal has a lot to do with vagal control. So like the vagus nerve is basically more activated when the tongue's in the right position. And I think even swallowing, I could be wrong on that,
Yeah.
but swallowing tends to activate
Yeah,
the vagus
so
nerve. Go ahead.
the vagus nerve is interesting because it is, I mean, you guys know it's so connected to our digestive tract and all of our like intestines and our digestion, our digestive processes, I think, and you guys can correct me, but it has to do with like motility, and it has to do with even, I think, the secretions that happen in all the digestive organs. Am I
Yeah.
remembering this correctly?
Yep.
Yeah.
Yes.
So so all, you know, it starts, obviously, it's a cranial nerve, it starts in the brain, but it affects so many other parts of the body. The big area that it matters for me is that it innervates, I think, from a sensory perspective, the larynx and pharynx. And so, if you're I kind of look at it as overall dysfunction. If you're breathing dysfunctionally and your tongue is swallowing dysfunctionally, then it's going to affect these other areas. So that's part of it. The soft palate, the larynx, that has like a motor component of the vagus nerve. But I think, yeah, it's like I want to say like the posterior part of the tongue, like the root of the tongue, soft palate, and all that area. So if you don't have good control, if you don't have good tone, if you're not swallowing effectively, and potentially, and I don't know any research to actually cite on this, it's all kind of hypothesis and what makes sense to me, knowing what I know. If you don't have good muscle tone, control, functional swallowing, it's got to have an impact further down. And so I can see it very clearly in terms of what I was talking about before with like, you don't chew well, you don't sleep well, increase inflammation, those things make sense.
Yeah.
But just from strictly like tongue posture of the base of the tongue and swallowing, that vagus nerve connection makes a ton of sense. So if that area is weak, and that's kind of where things start, and it has this ripple effect down the whole digestive tract and all of these nervous system, I guess, responses, then I think there's got to be a connection there. And that's what we talked about more before, I think.
Yeah, and if you're mouth breathing and swallowing poorly all day long, like it's sort of, again, it creates such a deficiency in those parasympathetic type systems over time. And it almost takes reprogramming to get you back in that parasympathetic and strengthening that parasympathetic response, because it's just been more deficient for so long.
Yeah. And I think with health, people always want like the magic bullet, like what's the one thing I can do that's going to solve all the problems? And in my experience, it's like 10 or 20 little things that all add up. And so, maybe getting your tongue to your palate and fixing your swallow and nasal breathing isn't going to cure your SIBO or your gut issues. But if you're not doing that and you've got like the perfect diet dialed in, but like your tongue is low in the back and you have low coordination, or you're tongue tied, or your mouth breathing, I think that's only going to prevent you from optimal like health and that, reaching those optimal levels that you're looking for. So it's like, you've just got to kind of, I guess, fill up the cup, or whatever that analogy is, like it's piece by piece. And, obviously nutrition is a huge part of it, but the way you breathe, the way your tongue rests, the way you swallow, that's going to be another piece of it. And if you don't address that, then you're probably not going to progress as well as you'd like to.
Yeah, it's not to say that it would be impossible to heal your gut with these things unaddressed, but it's going to make it a hell of a lot harder. Right?
Totally.
Like, if you can at least take care of this piece of the pie chart that is your health journey, and you can take care of like these big pieces and knock them out one by one, then that's where you start to see progress.
Yeah. And I mean, I think you guys have discussed it before on your podcast, but if you're mouth breathing, that changes the oral microbiome. And when you're swallowing that bacteria, that's going to change your gut microbiome. And so it's all these little things that add up. And, if your goal is overall better health, then you've got to have all those pieces. So
I think I've read also that breathing through your mouth, you actually get less oxygen to your brain than if you were to breathe through your nose. I'm trying to think of where I came across that. I'm pretty sure I read that somewhere. I saw that somewhere too. So it's kind of like your brain is anemic for potentially, 8 hours of your day, every single day of your life, if you're breathing through your mouth when you're sleeping, right? It's kind of like hypoxia, analogous to anemia, for those of you who don't know what hypoxia is.
It is, and it's interesting because we kind of think, oh, if you're mouth breathing, you're getting more air, like more oxygen, right? Like you can breathe in more. And so it sounds counterintuitive, but what our bodies actually need to like initiate or to optimize the respiratory process is we have to have a certain amount of CO2 built up in our tissues, in our bloodstream, in our bodies. And so all this information, I should say, comes from the Buteyko breathing method. That's where I've learned about a lot of this like oxygen CO2 balance that we have to have. So if you're mouth breathing, what happens is you're over breathing. So you're kind of off gassing too much CO2. And so what happens is your body kind of gets used to these like subpar levels. And then when you do switch to nasal breathing, it feels really difficult. So you might have a completely clear nose, the ability to use your nose, but your body is like all this CO2 is accumulating and you're like, oh my gosh, I have to mouth breathe. And so what happens is you have to reach like a new state. You have to increase your CO2 tolerance. And so there's so many great people who talk about this. Patrick McKeown has a book called The Oxygen Advantage, which is more geared towards health and fitness, like exercise. He has other books.
There was a bug in my office. If you're wondering what that was, there was like a fruit fly that just flew by my head.
That's funny. He has other books about mouth breathing and kind of the physiology around that through the Buteyko breathing, I guess, aspect. But I mean, really what is happening when you're mouth breathing instead of nose breathing is your body's not able to utilize and absorb the oxygen molecules as well. It still can, but we actually need that CO2 accumulation in our tissues to breathe to breathe optimally and absorb oxygen optimally. So
yeah, and I've read some of Patrick. It's McKeown.
McKeown,
Is that right?
yeah.
Okay,
yeah.
It's kind of like I want to always say like McCone or something. I don't know.
I know.
But I've read some of his stuff and I've seen some of his. He has some pretty good YouTube videos as well.
Yeah, he does.
Like if you're just curious, you can look up his name. Maybe we can link to him or something.
Yeah,
in the notes.
There's another great book that came out that is for like it's not meant for like professionals or practitioners, which is helpful. It's called Breath by James Nestor, and he's a journalist.
Just got that book.
Oh, you just got that book? Yeah. So
I haven't read it yet, but I just got that book recently.
He talks a lot about mouth breathing, and they did these like, I mean, they're kind of cruel experiments in the 70s where they plugged the like monkeys' noses and they watched the changes that happened to their facial structures and their breathing and their sleep. And he actually experimented and does that on himself, and he talks about it in the book. And he talks about the changes that happened to him physiologically and like mentally and sleep-wise by just forcing himself to be a mouth breather.
Weird.
It's crazy.
That's next level, man. Like, I always tell patients that I use myself as a guinea pig when I'm able to. Like, I did a whole coffee enema YouTube series where I did coffee enemas,
really?
not on camera for the record. But like, I did coffee enemas specifically so I could learn about them and teach people about them more effectively. That's next level, though, to force yourself to be a mouth breather for an extended period of time and like observe. I don't know if I'm that dedicated. You will not be seeing that on Triangle Holistic Gut Health on YouTube anytime soon, people. Sorry.
Well, and I feel like that's almost similar to an actor who loses, an absurd amount of weight for a role or gains an absurd amount of weight for a role where it's like unhealthy either direction. But yeah, that's wild. And I know one thing you mentioned too, which is, I think like Patrick might mention this in some of his videos, and I know you do too in your videos, but like mouth breathing can actually change like how you look. Like it can change how your facial structure is set up, which is so fascinating. Why don't you mention a little bit about that? For sure. So
it is so important because, okay, even if you don't care about health, if you're only focused on appearance and like, aesthetics, like this is still a field that can help you. Some people find me that way. And in my practice, I mean, my focus is all about breathing well, sleeping well, being healthy overall. But, if somebody comes in because they're like, oh, I don't like my cheeks or, whatever, there's a lot of cosmetic things. So I'll kind of talk about why that happens. But basically, it all starts when we're, babies. And so if you're not able to, I mean, this goes way back. So if you're not able to breastfeed, you learn to use your muscles differently. So it's kind of a controversial topic. Typically, breastfeeding, like the whole argument is, formula versus breastfeeding. Well, what I'm looking at is purely function. So babies who breastfeed end up with wider palates. They end up with a more functional swallow. They end up with so many things that if your baby's fed with a bottle, it doesn't matter what's in the bottle. It's just the mode of how those muscles are working. It's very different with a bottle versus breastfeeding. And so that's one area where it starts. So there's actually research talking about babies who are breastfed are less likely to have sleep apnea as adults. And it's because the function of the facial muscles affects the form of the structure. So function, it's like form follows function or whatever. So the way we use our muscles and the way we breathe literally shapes the face, the way our face is shaped as we grow. So because these things start so early, our bones and our jaws and our teeth and the structures of our face are so malleable when we're that young. So as we grow, if you're a child basically, and you grow into an adult and you're mouth breathing, your tongue is low, your mouth is open, your tongue thrust swallowing and overusing your buccinator muscles and your lips are moving dysfunctionally. These are all very minor things and they're very common, I should say. These are things that we see so often that we think they're normal, and I can break that down more. But basically, so you're a child, you grow into an adult, you're doing all these things. Well, adults who are mouth breathers, tongue-tied, tongue thrusting, all these things, they're more likely to have narrow palates. They're more likely to have vertical growth of their face versus forward horizontal growth. So they end up with often flatter cheekbones, narrower faces, just very different shape to their face than someone who grows up with their tongue in their palate, breathing through their nose, swallowing functionally. Those patients are more likely to have wide palates, forward facial development, more like prominent cheekbones and jaw lines and things like that. So all of the things that we consider to be attractive or beautiful or handsome are typically things that come from good function when we're young. And so obviously our family genetics, our ancestry, that's going to play a role. But if you come from a family, where maybe some of these things have already been happening for a few generations, it's going to affect you a lot more than if you come from a family where maybe there's different backgrounds. So yeah, it's very interesting. This stuff was documented back in I think Weston Price documented a lot of these changes way back when, and he was a dentist. He was looking at the changes to the teeth in within 3 generations, wide palates in the grandparents, and then they introduced processed food and softer food, and then within 3 generations the kids are all mouth breathing, they have low tongue posture, they have crowded crooked teeth, their facial shape is very different. And so there's a lot of environmental influences. Diet is one, but I mean, toxins, pollution, stuff in the air that leads to more mouth breathing, that's all part of it too. So it's just really, it's crazy to think that the way you breathe and the way you use your facial muscles will literally affect the way you look as an adult.
And I guess, not to sound doom and gloom, but is there, I mean, I assume the answer is yes, because you already specified that you work with adults, not children. Are you hosed? Say somebody
You're not hosed.
Say somebody learns about all of this, in adulthood. I don't know if you can change facial structure a ton in your adulthood, but if you're kind of so for the record, for example, I sound like I need to be your patient, and I'm probably going to be emailing you after this podcast because I had crowded crooked teeth as a kid, and I had I had braces in my early 20s. And when I had the braces, even the orthodontist was like, yes, you have a very narrow palate. And, showed me pictures of my palate versus other people. Mine's a V or a very narrow U instead of a nice, broad, wide one. And they wanted to do the crank thing to widen out. Oh, that I passed on that. That sounded terrible. But narrow palate, I was tongue-tied. I'm sitting here thinking through, I'm like, I don't know if you've seen a correlation too with children who are ear infection kids.
Definitely.
And people with sinus problems, but I was
definitely
chronic ear infection kid turned chronic sinusitis adult. And it's just all of these things I'm checking off the list in my head, damn. All right,
and that's why I say it's so common. And if it makes you feel any better, I was a mouth breathing kid too. And one of the reasons that I kind of got into this field is I was like, oh my gosh, I'm a hygienist. I've went to a really great school. I work for really smart dentists, and no one has ever mentioned this stuff to me in my whole life. Yeah. And I'm sitting here learning this stuff, and I'm like, I have these things, and luckily, I mean, I didn't have anything. I think so for me, if I never corrected my tongue posture and breathing and all these things 10, 11 years ago, I think at this point I would probably have some version of upper airway resistance syndrome, which is like a mild version of sleep apnea.
Mm.
I'm sure I would be, I would probably, so I mean, that's what happens is like it starts off as mouth breathing and then it progresses over decades into something much worse and much bigger. And if you never correct it or address it, and it's kind of this underlying issue for years and years and decades, that's when people all of a sudden are like, I have, what's wrong? I'm exhausted. They go to the doctor. They're like, you have chronic fatigue and sleep apnea. But they've had these symptoms for 4 decades.
Yeah.
It's just they finally got bad enough that they were recognizable and that now they can go to a doctor who will say, oh, you have something. So,
and that's what
but
happens
you're
with
exactly
so many conditions. Like,
so
you
many.
you start feeling like crap and you start having the symptoms of hypothyroidism, and then it's not until your TSH is through the roof that the doctor actually gives a shit about it, right?
Totally. But yeah, you're exactly like the type of person I would work with. I mean, those are the people, and you're not screwed. It's not too late. It just, by correcting these simple underlying issues, it can allow you to advance and progress in so many other ways. So by switching from mouth breathing to nose breathing at night, you might actually be able to clear up a lot of these sinus issues that you've had for so long. So
you know what's funny though? I'm sorry to interrupt you. I have never noticed that I'm a mouth breather. Actually,
that's good.
That's the one thing that I'm not checking off the list. And actually, I don't know if you're a fan of mouth taping at night, but like I actually tried that for a week or two to see, if that made any sort of notable difference. And I mean, I took the tape off half the time. That's good. And I would find it on the floor in my bedroom in the morning, but I don't think it made any notable difference. So that might be a sign.
Yeah. So in my courses, I talk about this, and this is kind of like higher level, but I'll just throw it out there. I actually have broken up patient phenotypes into two main categories. And there are really, it's like the mouth breathing, low tongue posture, kind of narrow face people, more like me. and they're kind of one phenotype. And then the other phenotype is more like clencher, grinder, tongue tie, more likely to have pain, headaches, and stuff like that. And they don't tend to relate to mouth breathing. So in my practice, I've kind of started to categorize it that way, because some people like you might fall through the cracks if we're only looking at it from the population of like, you have to be a mouth breather. But you can be a nasal breather and still have low tongue posture because of a tongue tie. So, maybe just getting the back of your tongue to be more effective, more resting up in your palate, that can help with the clearing. I mean, that's literally how the eustachian tubes work, is the back of the tongue activates the eustachian tubes to drain. And so when you swallow effectively, your ears will drain. And so what are you guys laughing at?
Nikki's mind's blown.
So we just booked this entire episode for me. That's what we're doing. Okay. This makes a lot of sense. And actually, that is one thing I'll disclose. Again, this is now all about me. Is as we're sitting here talking and you're talking about this stuff,
right?
I can feel like as I'm sitting here resting, listening to you, the front third or quarter of my tongue is on my palate. But then another thing the orthodontist told me is that my palate is really high, like really arched up in the back.
Yeah.
So I'm trying to play with my tongue like as you're talking, oddly enough, which you probably have heard people say that before, but it's weird for me to say on this podcast. Yeah. But I'm like playing with it, and at rest, I don't touch the back of my tongue to the palate at all. Maybe the first third of the tongue, if that.
And when you put it there, it feels so awkward and like, how is my tongue ever supposed to go like that?
Yeah. And again, it's like I'm reaching up for this insanely high ceiling that I have for whatever reason. So, okay.
Well, I'm happy to assess you at any point. And it might be that, you had your tongue snipped as an infant. Maybe it was never completely done. Maybe you have a physical tethering of the back of your tongue still. Maybe it's not physically able to go up all the way. That's a possibility. So it could have been a tongue tie release that helped you at the time, but maybe it wasn't enough for like optimal function as an adult. So the tongue's job is really to shape the palate. And so the reason that people with low tongue posture have narrow vaulted palates is the tongue was never there to kind of like remodel and shape the bone of the whole like maxillary arch. And so if the tongue's low, the teeth will always be crowded and narrower, and the palate will always be vaulted and higher. So I know, crazy, right?
Meanwhile, and I'm not even kidding. I'm going to get your email address from Amy, or I'm going to get your
Totally,
info
I'll
from
help
Amy
you.
and reach
Yeah.
out, because this is actually really apropos too. So my ear infections and my ear history was so bad that I've had tubes put in 3 different times as a child. And then I had eardrum reconstruction. I had tympanoplasty done 3 different
Wow.
times, once on the left, twice on the right. And I don't know if I told Amy, I think I did. I actually just set the date for tympanoplasty on the right side because I still have a hole in that eardrum, and I'm going to get that
Oh
done
my
in February.
goodness.
So I need to work with you in
Yeah.
the coming months, because
Yeah,
I don't want to
definitely.
go in getting an eardrum reconstruction and have them redo that eardrum and then have my tongue posture and movement be all doing whatever. And then who knows, maybe I'll blow the stupid eardrum again and have to get another damn surgery. So I want to keep this eardrum at all costs once I get it in February.
Yes.
So
So you mentioned in the beginning, in the intro, I work with an organization called the Breathe Institute, and it's led by an ENT and researcher, Dr. Sarush Zaghi. And in their practice in LA, he's an ENT who actually doesn't do ear tube surgeries. He's never had a need to. They find if you release the tongue tie and you do the myofunctional therapy, you get the function, and then you don't actually need to drain the ear from the outside. The ear will start to drain naturally as it
Right.
should on the inside. Amazing, right?
Well, yeah, that's the thing, is I always kind of wondered, why didn't the ear drain appropriately? Or why
Yeah.
did my eardrum never heal? Because eardrums should heal themselves normally.
Should,
They
yeah.
don't always necessitate surgery. A lot of things coming together.
Good,
A lot
good.
of things. So fascinating.
Oh my
Well, that's the
gosh.
thing.
Well,
I mean, these things are not, it's just not that well known. I feel like this is information every parent should know, Kids should breathe through their nose. We should learn how to clear our nose just the same way we learn to brush our teeth. We should learn how oh, when my nose is stuffy, I have to blow it, or I have to use a saline rinse, or I have to use a neti pot. We just don't even have these discussions. Your tongue should go on the roof of your mouth. Honestly, you shouldn't need a therapist like me. These are things we should do naturally and innately from the day we're born. If we're not doing these things, something's gone wrong, and now you're kind of having to course correct. So no one should need my profession, but a lot of people do.
Likewise, nobody should need us either.
Yeah,
in theory.
totally.
I'm glad we're here to help
Right?
people.
Yeah, me too.
Yeah.
Me too. Here we are. But yeah, we should all be obligate nasal breathers. No one should ever have to say, "Oh, you need to use your nose for breathing."
yeah.
That's kind of common sense. Weird.
Yeah.
Your tongue should be in the top of your mouth, not the bottom of your mouth. And so, yeah, I mean, there's a million reasons why it's so common now, but it didn't always used to be. Our ancestors didn't have these issues, and people who live in less industrialized Western type of societies typically don't have these issues either. So,
I think it's interesting, and I think you're doing such great work bringing attention to some of these issues. And I will say, I think you're making headway, because I don't know when it was, but I was at my mom's house. So my mom's a speech therapist.
Okay.
So she works with elderly adults. But both my sisters, one's in dental school and one's a dentist. So I'll have to get them to watch this episode. But I lived with my parents for a little bit before I kind of started my practice and got everything going. But when I was living with them, so my mom belongs to, I think it's ASHA. It's their
that's the American Speech Language Association or something. Yeah. Speech, language,
so
and
it's
hearing.
their big, it's their big organization. And they did have an article in the ASHA magazine. I don't know why I was oh, I'm going to look at this ASHA magazine. I was eating breakfast or something.
No, she was sitting on the toilet. She was pooping and she needed some reading material. That's what it was.
Yeah. Okay. Whatever it was. So I picked up the ASHA magazine, and they were talking about kids with ADHD being mouth breathing in the ASHA magazine, which I was kind of oh my gosh. And this was after I had already talked to you. So it was in between 4 years ago and now. I don't know when exactly it was.
It is changing. More and more dentists know about it. More and more speech pathologists are understanding it. Hygienists like me are learning about it, wanting to do this as a profession. And so, I mean, the amount of change that this field has gone through in 10 years, and even more so in the past 5 years, is astronomical. It's crazy. And I think it's a perfect storm of things. social media is a big part of it. Things can get shared differently. People can join groups. 10 years ago, we all think, oh yeah, social media has been around for 10 years, but it was so different back then. It was not the same as it is today. Then also that research component. So most of the research that we have in the field that is like good, high quality, legitimate, and like really like game changing is from 2015 forward. A lot of it 2017, a lot of it just 2020. Like there was a big article with like over 10,000 kids just published, and I'll have to share it with you guys. I don't have it off the top of my head, but basically they said in kids who are mouth breathing and snoring, they actually have like clear cut evidence that it affects the gray matter of their brain. Their prefrontal lobe is affected and smaller in kids who mouth breathe versus nasal breathe. And that affects our ability to regulate our moods, our ability to control our feelings and express ourselves. And so a lot of what we see as ADD, ADHD, learning issues, a lot of it has to do with like, wow, these kids are mouth breathing and they're not sleeping well and they're not getting oxygen. And maybe if we just address these things, then maybe they would do a lot better in school. Maybe they would be maybe they would grow better. There's a lot of research about growth hormone in kids, and kids who mouth breathe and snore at night are smaller and underweight for their age. As soon as they start nasal breathing, they grow like 6 inches. It's crazy because all
Oh
of a
my
sudden they're getting
gosh.
into deeper stages of sleep. Now they're getting growth hormone and now they're just growing, and it's amazing. So
Well,
there's a lot of really interesting stuff.
that's further proof to you that I don't think I was ever a profound mouth breather because I'm 6 feet tall. So I think I had the growth hormone
You got
for
that, yeah, no
most of my
problem.
adolescence. I at least have that much going. So I clearly belong in this other category that
Yeah.
you described.
Oh my
Oh,
gosh.
geez.
The listeners
You
are
crack
getting
me
so
up.
much information about my health today.
Yeah, they are
Random stuff.
It's
downloaded.
good. It
Well,
actually
watch
makes
now.
it more
My
relatable. Yeah, I mean, I think, and so when I give lectures and I speak to big groups of healthcare professionals, mostly dentists, I always say, I want you, as we go through this lecture, tune in to your own breathing and tongue posture and really be honest about your own symptoms. Because if you have these things, you've got to address them. And they're
yeah.
so common that we all just think they're normal. And so I really kind of challenge the healthcare professionals to start to try to understand and make it personal, because once it's personal to you or it affects your kids or your significant other, now you can't unsee it. And now
Yeah.
you're a lot more likely to help talk about this to your patients. And it's not the standard of care. It's not part of mainstream dentistry. So it's challenging for the dentist to now start talking about these things they're not used to, and like, what do we do? And,
Mm.
to go back to, okay, now our structures are all impacted. So, okay, now I've got a narrow palate. Now I have like, this vertical growth and these other issues. Well, I mean, sometimes it does require more extensive orthodontic treatment. If you've got severe sleep apnea and your mouth is too small for your tongue and your airway is super narrow because of your structural development, well, now we need to start talking about things that nobody really wants to do, like orthodontic treatment as an adult, MMA, like jaw surgery as an adult. I mean, I'm not a
Or like
fan of those things
the
if I
palate
can avoid
expander
it.
thing
Or the
that I
palate, yeah, where
mentioned.
you crank, you like open the palatal suture. I mean, these are more extreme things, but for some people who are really struggling with their sleep and breathing, they might have to alter the structures because those structures are now compromised as well as the soft tissues. So that's the challenge that I face all the time.
Mm.
Yeah.
Now, is there could you give any advice, like if people, maybe some of our listeners haven't heard of a tongue tie? I don't know. Amy, are
hmm
you
hmm
familiar with tongue ties other than what we've just discussed now?
I'm familiar with them.
Okay.
Um,
Because I think I
Yeah,
but
fell
go
there's
down
ahead.
the
there's
rabbit
some
hole when my daughter
there's some
had hers.
nuances, but
Is
yeah, I mean, most people, if they look at, okay, if you open your mouth to its like maximum opening, and then you lift up your tongue should be able to reach your teeth when your mouth is open wide. So that's one easy test. If you can't open wide and lift your tongue, okay, you can kind of screen yourself right out and say, yes, maybe I have a tongue tie. Now, the posterior tongue tie, which I can see if you have any degree of tongue tie, it's going to be in the back part of your tongue, because the front part of your tongue is like very easy to move,
yeah.
stick out, lift up, like you're good. But that's where it gets harder. And so what the best thing that anyone listening to this can do is just start to become hyper aware of your mouth and your breathing. So think about the tip of your tongue and where does that rest inside your mouth? Think about the middle of your tongue, the back of your tongue. Is it easy to keep your lips together, or do they naturally want to part? Even if your lips are just apart like 1 millimeter, that tells me your tongue is probably low. Maybe you're not mouth breathing 24/7, but if you're mouth breathing even, I think the number's like 20% of the day, it's still going to impact the structures and the function and everything else. So it doesn't take a lot of mouth breathing. And I will say, most of the patients I work with, if you ask somebody if they mouth breathe, no one ever says yes. Like no one ever wants to admit to that. Like no one wants to be a mouth breather. It's kind of embarrassing. So
I'll ask your feedback on this. So I think this was I think I learned about this on a podcast a few years ago. It's, oh God, what's his name? He's a dentist. Mark something.
It's
Mark Verhenna?
Yeah, that's
Ask
him.
the Dentist. Yeah.
Ask the Dentist.
Yeah.
He was
He's
on
a friend. He's
podcast
good.
a number of
I
years
like him.
ago. And he was talking with Mike Mutzel about mouth taping, and that's where I started to become a little bit familiar with this idea. But I remember they talked about a couple of symptoms, and I've since put them on my intake paperwork for new patients. So I asked people, do you snore? Obviously, like that's a given. And then I ask, do you wake up with a dry mouth?
That's a good way to like kind of hide the question, because people say, no, I don't mouth breathe, but do you wake up with a dry mouth and drink water?
Like,
yeah, I totally do that.
And then I ask, do you wake up with a stuffy nose that was not stuffy when you went to bed? And I ask, do you wake up like in the night or first thing in the morning and you feel like, oh my God, I need to drink water? Do you need water at your nightside table? Because your mouth is dry like the desert. But those are kind of my questions. And if people are answering like one or two of those affirmatively, or if they say snoring at all, I'm usually at least having them try out mouth taping. But now I think maybe I need to recommend this in addition to that. I think that's just one piece.
Yeah, I mean, talk about tongue posture. And so I always tell patients, because like it's a lot of work to work with me. Like you have to meet with me for like 10 to 12 sessions. You have to practice these exercises. There's so many things that in a dental office or in a like practice setting like you, if you just give people these tips and things to work on their own, there's so much people can try on their own before they actually pay someone, to do therapy with. And I always tell people, if you can do this without me, awesome. Like that's better. But if you need help, I'm here. And so you can tell people, here's where your tongue should go. I have this, I know that anyone listening can't see, but I'm sure Amy's seen this, but I have this mouth and I've got like these markings here, like on the palate, like here's where your tongue should go. And so just showing people that, like, oh, wow, I never knew my tongue should go up there. People will discover that they're tongue-tied just by the fact that it's challenging for them to keep their tongue up. They're like, you know what, I physically can't do this with my tongue. So then they have that personal discovery that, I think I'm tongue-tied because I can't keep my tongue up. So then I don't have to tell them. They have this, I think it's always better when people own it. They understand it themselves, right? You guys probably get that too. And so when people can tell you, yes, I've discovered that I'm mouth breathing. Yes, I've discovered that I'm tongue-tied. Now they want to figure out, how do I fix it? So talking about tongue posture, talking about lip taping, which I love mouth taping at night. I mean, it's a big thing that I talk about a lot. I think it's like, people think it's so weird when they've never heard of it.
Oh yeah.
But you will sleep so much better if you breathe through your nose all night. And it's amazing. So it's just funny how it works that way. But I always say
say that they have an improvement in energy too. Like I usually tell people, give it like a week minimum, because you'll think it's weird and hate me at least one of the nights that you try it. You're going to be like ripping off the tape and saying, I hate you, Dr. Daneza. But give it like a week. And then a lot of people, I would say out of the people I've recommended it to, probably 80% of people come back and they're like, damn, I feel like I have more pep in my step. I feel like I have better energy.
Definitely.
Like,
I'm more well rested. I have more energy. Yeah, all that stuff.
Less brain fog.
Definitely. And that's just from switching to nasal breathing. So if you can get the tongue up on top of that and adjust the swallowing pattern on top of that, then now you've really changed like the function of that whole oral, muscular, respiratory complex. And that's the goal for me. That's what I want to do for people. So, yeah, the lip taping, I always say, start off during the day, do it for like half hour
Mm.
while you're like watching TV or reading or cooking dinner or something. So you get used to the feeling of the tape on your lips and it's
Mm.
not so disruptive to your sleep. If you just try taping and then going to sleep, you're going to hate it. So you've got to kind of practice, get used to the feeling, do it for a couple days, and then try sleeping.
Oh, okay.
And then I mean, that's just personally what I do, but
No, that's a good pro
Yeah.
some
tip.
people, some people just want to, dive right into the nighttime. I'm like, well, you can, but it can be disruptive where people then don't like it. So for me,
Right.
trying to like, I want to like win them over, like bring them to the mouth reading or the mouth taping side of things. And so I'm
Yeah.
like, start during the day, get used to it, and then try night.
My
Yeah.
favorite too is, sorry, Amy. My favorite
No,
too
go
is
ahead.
that I ask if their spouse or partner snores.
Yeah.
Because, right,
Mhm.
like if your spouse is sawing wood and keeping you up at night, then you're also going to sleep like shit. So no
Yeah,
amount of, kava kava or CBD oil is going to correct that.
totally.
So
Exactly.
sometimes if I see that questionnaire of, oh yeah, my
Hmm.
husband snores, then sometimes
Yeah.
I'll even send home the instructions like, okay, and I hereby volunteer your husband to do this with you. And then you can
Yeah.
put your mouth tape on and lay in bed and turn out the light and try to mumble like,
Yeah.
I love you,
Exactly.
dear, but with the mouth tape on. It'll be a thing. It'll be great. It'll be couples bonding.
Oh my
Totally. So
gosh.
it's funny. Oh, sorry, Amy, you were gonna say
Oh,
something, then
I
I'll.
was just gonna say, Nikki's like basically describing my husband and I's like good night because I wear mouth tape and he snores and I
Oh.
make him wear mouth tape.
Ah,
Yeah.
But I think like for me, what sort of made me, or what indicated to me that I was mouth breathing at night was grinding. Like, so my
Hmm.
dentist, I go to a little bit more of a holistic style dentist. So he was like,
Hmm.
"Oh, based on what's going on at your gum line, I'm pretty sure you're grinding. Like you don't have damage to your teeth, but you're
Hmm.
grinding." And I could tell, like you can kind of tell that you're grinding.
Hmm.
You have a little bit of like I wouldn't describe it as TMJ, but some soreness
Yeah. Yeah.
in the mornings. So that's sort of what prompted me to do mouth taping. And so I
Yeah. And did
started
it go
mouth tape.
away?
It did go away. So he gave me a mouth guard for a while, but I didn't like the mouth guard. But I found that when I taped, I didn't need the mouth guard because I didn't grind.
Yeah. So
Um,
people might be wondering how that's related, and
mm,
it's actually really interesting how grinding. So you're like, if you're grinding, like, how are you mouth breathing? Like
right.
how do those things go together? Like how do you do both? Your mouth's open when you're mouth breathing. So
yeah.
like how are you grinding? But what happens is in different stages of sleep, um, you're if you're mouth breathing, you're actually having some degree of upper airway resistance. And so you might not even be snoring, but if your breathing is like more it's not obstructing fully, but it's like almost obstructing, so it's strained. And so what happens is your body goes into fight flight mode and you clench. So depending on the stage of sleep, you're clenching, you're grinding, and then you go into a different stage of sleep and now your mouth drops open. And
Mm.
so it's very likely that you were having some degree of like upper airway resistance. If you're clenching,
Mm,
that tells me that your body's in that sympathetic state. And like, imagine trying to be in a sympathetic state while you're asleep, right? That's so
right.
counterintuitive. No wonder people don't sleep well. Like,
Mm.
if you're
Right.
clenching, grinding, your body's in fight flight mode and you're just supposed to be asleep. Like, what?
Yeah.
So
Doesn't quite work.
Well,
it doesn't quite work.
and I would say too, the thing that I noticed most when I first started mouth taping was feeling like I was getting more in REM, so like deep, like more vivid dreams, so
Yes.
to speak. That's
Hmm.
one thing that I really noticed personally is I felt like I wasn't dreaming as much. And then when I started
Hmm.
mouth taping, that was like the earliest thing I noticed was that, oh my gosh, I'm like dreaming way more. And I feel like I'm
Yeah.
kind of getting more into
No,
that
that's true.
REM cycle sleep.
It's common feedback. The other thing that's interesting that a lot of people who have like nightmares or scary dreams, that happens when your body's in that fight flight stress state. So your airway's obstructing, your breathing is bad, your body's like, you're pumping up adrenaline. Like, so if you've ever woken up from a dream and your heart's racing, you are probably having some sort of an airway obstruction or breathing issue while you're asleep, because your body's like working, like, I got to get out of this. And so your mind, obviously reflects that. So I don't know what percentage of bad dreams come from breathing issues, but I would think a lot. I actually think quite a few do. So
That makes sense.
I've heard a few people talking about this in my field, but I don't think we have any like research around that. It's really hard to research dreaming. So
Yeah. Interesting.
yeah. Oh, the one other thing I was going to say, sleep hygiene is a big area of what I do also. So this is like beyond myofunctional therapy, but the things we're talking about, taping your mouth at night,
Yeah.
even wearing earplugs at night, eye masks, don't be on your phone with like blue light blasting into your eyes, but when you're trying to fall asleep, just that kind of stuff. I incorporate a lot of that into what I do. And yeah, it can make for interesting, like, if someone's dating, like, hey, let me put on my mouth tape, or like you said, with like your husband and you're both putting on your mouth tape and stuff like that. So it can make for some interesting conversations.
For sure.
It could
The
make
blue light
dating kind of
blocker
fun.
goggles, the mouth tape.
Yeah.
Totally, earplugs, eye mask.
Yeah, I definitely have an eye mask. Eye mask and like the tape isn't necessarily the sexiest
Nope.
sexiest look,
hey.
but
I'll throw this
It
out, by
works.
the way. This kind of dovetails, recent event in my life, but it dovetails into the conversation. So Amy and I have talked about sleep to some degree, and we just are hot off the heels of 2 episodes about blood sugar. So we talked about high blood
Interesting,
sugar
okay.
and then low blood sugar and how it affects the gut. Well, interestingly, so right now, this is actually the last day that this one's valid. I have a glucose monitor on my arm, so it's getting a continuous read of my blood sugar. So I did a fast yesterday, and with the intention of doing 2 or 3 days. I've done this a handful of times, and my body usually responds really well. And last night, I didn't get really great sleep, and I actually woke up at like 4:45 in the morning, which is very weird for me. Usually, I'm like dead to the world in the morning, so waking up that early is extremely atypical. But I woke up at 4:45, could not fall back asleep for the life of me. Got up, went to the bathroom, and while I was in the bathroom, I figured I would scan my doodad on my phone. I don't know if you could see this super well, but at the time, my blood sugar was 63. But look, it was low all night long.
oh,
Dipping down.
Interesting.
And I couldn't sleep. It was like my body was just like totally awake. Not necessarily heart racing adrenaline, but I think that my body was in fight or flight mode all night, unbeknownst to me.
That's so interesting. Huh.
Yeah, so I got up for a little while. I had some glycerin, and usually that'll help kind of bring me out of that hypoglycemia. Didn't really do anything. So finally at like 5 o'clock in the morning, I was like, I'm going to make breakfast. And I made myself a very big breakfast. And then I was just like up for a while, but before my husband and kid got up. And then after they got her off to school, I went back to bed and took a nap for an hour. It was glorious. And my blood sugar was totally normal the entire time. But, it
Interesting.
makes you think of all these things that would impact our sleep. And then you're going to feel like crap and you're going to be inflamed potentially day in and day out for your entire life. That's a huge deal.
Yeah. Sleep is such a big deal. And we always think of like diet and nutrition, diet and exercise, or nutrition and exercise. And we don't really think about sleep as such a big deal as part of like the overall health equation. It's kind of like, oh yeah, you can sleep when you're dead, or, like sleep is for weak people, it's kind of like that. Yeah. It's just like part of our like culture is to kind of think that if you need too much sleep, like you're just, I don't know, like you're not a hustler.
Yeah.
yeah.
I disagree. I love sleep so much.
I disagree too.
But yeah, it was weird that even after just the one day, I don't know why, like right now in this moment in time, my body didn't adore the fasting at night. Because usually that doesn't happen to me when I do these 2 or 3 day fasts. But I think it was just another opportunity for me to listen to my body. And I was like, okay, clearly you're pissed. And this is, for whatever reason, this date, this time, in this universe.
I've been curious.
Cool.
I've wanted to do that. I've wanted to just try the continuous glucose monitor just to see like, what is my body doing, just to kind of get like, baseline reading, feedback, understand kind of what's going on with me. And I've never done it. So
Yeah,
Should
it's
give
a
it a
fun
try
little
sometime.
gadget. This one, I got it. It's a prescription, but I just told my provider, I was like, I know I don't have the diagnosis codes for it. I want it anyway. I'll pay out of pocket. And
Yeah,
they were happy to
that's what
write
I
the
would do.
prescription. Yeah, and then it was pretty cheap.
Cool.
But yeah.
I still need to do the CGM too. I'm curious
It's a
about
fun
myself
gadget.
as well. It is. I feel like I might be a little obsessed with it. Like, what's my blood sugar now? Like, I might be a little bit too checking all the time.
Yeah.
So I'd have to ebb that reflex to want to check all the time, but
We would have to give Armand the little reader device, and then he could be the designated scanner person for you, and then you're not allowed to put the app on your phone.
that's probably a much better solution than me checking obsessively.
Yeah. Yeah. Oh my gosh. Well, guys, this has been very eye-opening. Can anybody think of any other nuggets? I feel like my brain is like overwhelmed processing everything in a good way. And again, I clearly have to email Sarah ASAP and like
Please do. I'm happy to help, and it's good to have these discoveries, and like I said earlier, I think having you kind of go through the self epiphanies, it really helps people listening, and it does help people understand, when there's more of a personal connection to it. So even just hearing your personal connection can make other people think, well, maybe I have that too. And again, I feel like this stuff impacts over 60% of our population. And so if not higher, I mean, probably like 70%. I did hear there's a dentist. Yeah, there's a lot. It's a lot. Like, it's overwhelming for us, the dental providers and the speech pathologists who start to get into this field. We start to think, oh my gosh, am I overdoing it? Or is there really this many people who have these issues? And not everyone who has myofunctional symptoms is going to have like the full on, horrific sleep apnea, but a lot of it's just a quality of life issue. If you're not sleeping well, you're not breathing well, maybe you're just a little sluggish, maybe you're just, having some digestive issues, and you don't really connect that maybe it has to do with your tongue and breathing. And so most people, they feel like they have symptoms, but they always think, oh, my neck and shoulders are sore because I sit at a desk all day. They might not be thinking that it's because of a tongue tie and all the muscles of their neck and shoulders are under extra strain because their tongue can't move fully. And so we always kind of associate these symptoms as like, oh, these are normal, this is related to my profession, or because I'm a new mom, or because I million other reasons. And so I think sometimes it's good to just kind of figure out the basic stuff, and then it can help with these much bigger areas that you don't really expect.
I feel like if there's any executive summary from our podcast, it's that everything's connected to everything else. So,
Definitely.
It's the IBS Freedom Podcast. And here, today's topic, at first glance, when people saw the title, they probably think, oh, this is really random. But hopefully we kind of built the case how it's connected. And like blood sugar doesn't seem like it would intrinsically affect your gut, but oh my God, it does. And hormones affect the gut. And like it's all connected. It's just a matter of how our understanding of the connections is.
Definitely. Even so if hormones affect your gut, and sleep drastically affects your hormones, and breathing drastically affects your sleep, like here we go,
Yeah, and then you're off to the races. Or even like, structurally, all of our physical bits, all of our muscles and bones and tendons and ligaments are interwoven with this connective tissue fascia stuff throughout the body. And that stuff's weird. When you start getting into it, I'm sure you have. But like there are fascial planes that connect down into like the heel of your foot, go all the way up the back of your leg, up the back of your spine, up the back of your neck, and then they anchor, that same fascial plane anchors to your eyebrows. How does that make any sense?
Well, that's interesting you say that, because there's a fascial plane, the deep front line, that literally connects your tongue to like your diaphragm, your lungs, your ribs, like all the way down to your feet. And it's one fascial plane, one chain of fascia, and it's called the deep front line. And when people get their tongue tie released, they talk about how it changes their hips, and they feel like my chest is opening up, I can breathe deeper, my walk is different. And so people say, and this doesn't happen to everyone who has tongue tie surgery, but there are people that I know, and that, surgeries that I've seen where people are like, I feel it in my quads. And I'm like, what?
And it's interesting. I just did a Google image search to pull that one up because I wasn't familiar with that one off the top of my head.
The deep front line?
It's going all over the place. And
Yeah. I
You know,
learned that
even,
it's Dr. Thomas Myers.
yeah, the anatomy
Yeah.
trains guy.
Anatomy trains. Yeah.
Yep. Yeah, I've got his book. That's what I was talking about, like these planes
What
that
is
go
the
all
one
over the
you're talking
place.
about? Is it like the back line or what is that? Is it like
It might be. I forget
the
the
heel
names
to
of
the
them.
forehead?
Yeah, I think. I mean, I could bust it out. Let me look.
Yeah, I mean that to me is really that's just like the tongue and the toes, like the heel and the forehead is like
Right.
insane.
It seems like
It's
it makes
so
no
random.
sense, but there's definitely a rhyme and a reason.
Oh yeah.
Well,
Um,
so I think about things all the time, like, and this is totally random, but the forehead things make me think of it. So if you get Botox, how does that affect your heels or your walking?
oh
Oh
Like what
my
does that do?
gosh.
yeah. Ooh.
Right?
This. I was just telling somebody the other day. In another universe, I would be a researcher, but like all of the
Hmm.
research I would be interested in, nobody's going to fund it. Pfizer doesn't give a
Yeah.
shit
Right.
about, what I actually want to research. But this is the kind of
Uh-huh.
stuff like, how fascinating would that be to take like 1,000 people, give them Botox in their forehead, and then observe their gait? That would be
Yeah.
so cool. Oh, it's never going to happen though, because
Totally.
who cares enough? Who's going to make money off of that study? Nobody. But to
Oh,
answer your question,
you guys are just as dorky as me. I love it.
yeah,
Like I think
the
about these things too.
the
Yes.
the plane in question that I had brought up is the superficial backline, from
Okay,
what
so I
his
got
book.
the
Yeah.
backline part. Superficial backline. That's very
Yeah,
cool.
yeah. So it basically goes into the plantar fascia, even a little bit beyond the heel, up the calf muscles, up the hamstrings, up the paraspinal muscles, all the way up the neck, top of the head, anchors on the forehead or the
That's
eyebrow
so
bridge.
cool. I love
So
that.
weird. So weird.
Yeah, so check now you have the deep front line you can talk about too when you're talking about
Yeah.
fascia. It's
Yeah,
fascinating.
I'll have to look that one up. It actually
Hmm.
looks quite a bit bigger and more extensive than this one.
It's the tongue is connected so much to the diaphragm. It's crazy. So people always talk about changes in their breathing when they get their tongue tie surgery.
Yeah, very
Hmm.
interesting. And you would think
Trippy.
just because like the mouth parts do the breathing, and now that's going to
Hmm.
change, but it could be fascial.
Yeah,
It's
yeah,
funny,
it's
like
crazy.
I took dissection anatomy classes, like dissecting human cadavers in undergrad
Uh-huh.
and grad school, and I loved it. So if it wasn't for the nasty formaldehyde
Hmm.
smell, I would be doing that for a
I
living because I
know.
loved it. But if you think about dissection, we would hack all the fascia out. We're like, get rid of this
I
crap.
know.
Nobody wants
Yeah, isn't
this.
that interesting?
I want to see the
Yeah.
muscles and the bones and the ligaments and the arteries. Nobody gives a shit about the
Uh-huh.
fascia. And then this guy comes
Exactly.
along and he's like, no, bro, the fascia is its own
Hmm.
special thing that we need to pay attention to. And I'm like,
Yeah, I mean, yeah, it blows my mind too. It's like a second nervous system, and like people talk about it storing emotions and like traumas and like all sorts of things. I'm like, whoa, whatever that
yeah,
means, it sounds really crazy.
yeah, it's wackadoo stuff, but it's really cool. And again, it just goes to show you everything in the body's connected. Like the
Hmm.
hair on your eyebrow is probably connected to your kneecap, and that's probably connected to your thyroid. But like
Right.
our understanding of the connection is probably just what's not so hot yet. But the good
Yeah,
news is
yeah,
science is
exactly.
not done. Research is being done every single day, so we're going to keep learning about the human body for our
Hmm.
entire lives.
Yeah, yeah, it's so cool. Well, thank you guys. This has been really fun.
Yeah.
Yes.
Well, and I'll have to put, I know I got some links of like YouTube channel, social media links, and then website links that I can put with this
Yeah,
episode so that
my
everyone.
YouTube channel, I'm not great at updating it all the time. It's kind of just something that it's there. It's got great information. I don't have a ton of new videos. Instagram is probably what I'm on the most. Anyone can feel free to email me. My practice is called Faceology. If you wanting information as a patient, I have four myofunctional therapists that work for me. They see the majority of my patients. So if you reach out, you'll probably end up connecting with one of them. But Nicole, I'm happy to work with you. So
Yes.
you reach out to me, I got you.
I already pulled
So
up your website. It is myfaceology.com.
yes,
Mm-hmm.
yes.
Done deal.
So myfaceology.com. If you're a professional, if you're like a doctor, dentist, speech pathologist, and hygienist, and you're listening to this, like, hey, I want to learn that. You can take one of my courses. So I have another website called myomentor.com, and you can check that out for training. So yeah,
Awesome.
that's
Awesome.
me.
Well, and I will say one of your YouTube videos, I'll send it to a number of people. It's like how to unblock your nose.
Yes, it's so old. Oh my gosh, I'm so embarrassed by that one, but it's really good. It has so many
Never
views.
mind.
Like,
Where
I
have you
can't
been
take
all
it
my
down.
life? Like, darn it. All these sinus infections, all this stuff.
I
Man.
know.
Oh my
Yeah, no, you
God.
can send it to people. Go for it. It's from like 2014. So I always watch it. I'm like, oh my gosh, it's so funny, when you watch old videos of yourself,
Right.
but it has like millions of views, so I can't take it down. So, or
Yeah.
hundreds of thousands. So I'm like, I
Yeah.
really want to just like scrub that from the internet, but hey,
Right.
it's got a lot of
Right.
views. I
No,
can't do that.
nope,
I
don't
get
do it.
that though.
Yeah.
Yeah.
Yeah. Well,
Well,
So,
cool.
this was so insightful, and yeah, I feel like my brain has to process everything in a good way now, and I'll reach out to you. And like I said, mission, keep the new eardrum, February 2022. So the timing is very
mission
cosmic and
save the
spooky and
eardrum.
perfect. Yeah. Hashtag save the eardrum. So the kids
Yes.
can follow the journey. But oh my goodness, thank you so much for coming and sharing your
Oh,
expertise.
you're
And
welcome. Thank you
Yeah,
guys for
this was
having me. I'm
awesome.
glad that it worked. I know we had to reschedule like 3 times, so hey, thanks for that.
No, it was
We
worth
made
the
it.
had
We
wait.
you
got
on.
it.
Amy put in the good word for you. She said you were legit, so I knew you'd be worth the wait.
Did I steer you wrong, Nicole?
No, Nicole. Oh,
I know. I said
forget
Nicole. I don't know.
that.
I'll
That's
get
what
ready.
What do
the
you
thing
normally
says
go
on
by?
GoToMeeting.
Nikki.
Yeah, yes.
Nikki? Oh,
You
okay.
Yep.
Okay.
you did
I
not
called
steer
you
me
that, but
wrong.
it's only because
Well, it is.
I
My
think I-
legal name is Nicole. Like on my website, for example, like my license is under the name Nicole Dineza.
Right.
99% of the time I go by Nikki because Nicole just sounds so stuffy. I
Well,
never
it's
really
funny
resonated with Nicole.
because I never call you Nicole, but then I think I was looking at your little name,
Yeah, the little thing on the GoTo.
and I
thing.
think that I looked at it and I said it, and immediately when I said it, I was like, "Oh, that did not.
Like, oh, jarring.
That felt wrong.
Yeah,
That felt wrong."
yeah. Even a lot of my patients call me Nikki, honestly. It's
Right.
like
Okay.
I'm more accustomed to answering to that. Although,
Oh, cool.
yeah.
Awesome. Well, I'll remember that for next time.
Yes, that's right. We'll talk. You and I will be talking very soon. But
Perfect. I love it.
but yeah, it was such a pleasure, and I'll go creep on you on Instagram and find. What is your Instagram handle, by the way, for the audience and for myself?
It's Sarah_K_ Hornsby. So Sarah K. Hornsby.
All right,
Mhm.
hold on. Sarah. And you spell it with an H, right?
Yeah, with an
Sarah
H. Yep.
Okay.
Mm-hmm.
Found you.
Yeah. Awesome. Perfect.
Oh, actually, you are kind of a big deal. Ask
Why?
the Dentist follows you on Instagram.
Yeah, he does. He's a friend.
How funny. Oh, okay. Well, look at that. I am even more impressed in ways that are insignificant
Oh
for
my
sure.
gosh.
Isn't it weird
You
how
crack me
social
up.
media...
We've done quite a few like interviews and things together.
Oh,
So
okay.
if you look through my YouTube channel, you can probably see, maybe if you look through theirs and their
Mhm.
website, I've written some articles on their website and stuff too. So
Oh, okay.
yeah. Yeah.
Look, it's a small internet world.
It is a
Yes.
small world.
How funny. Well, it was an absolute pleasure. Amy, you want to do the outro, or shall I? Should I
You
put you on
can
the spot?
go for it, Nikki.
Okay.
I'll have you do all the work, all the intro and outro.
I'll be the
work.
MC. Yes, but
Right.
you introduced Sarah beautifully. So a round of applause for Amy for the intro, because that was out of her element for sure. But yeah, guys, thank you so much for tuning in. You know the drill. If you are listening to this on a podcasting app like iTunes or Apple Podcasts, if you could rate us 5 stars, that would help us grow this channel and grow this podcast and get it out to more people. If you're on YouTube, send us a comment down below, like the video, give us a thumbs up, whatever it is that YouTube is doing these days. And we are gathering those comments, and we do Q&A videos on Instagram Live every so often. So make sure you're following both myself at Triangle Guts, that's plural with S, and Amy_Hollenkamp_RD. And that way, when one of us goes live with the other one, you're going to be privy to it. And we will see you right back here next week for another episode of the IBS Freedom Podcast. Until then, toodaloo.